Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm so excited to be talking with Dr. Judy Fingergut, a primary care physician who recently joined NMC as the medical director of both of our Northwestern Primary Care and Northwestern Georgia Health Center. So welcome, Dr. Fingergut.
Thank you so much for having me this morning.
Yeah, it's wonderful to have you here. It's wonderful to have you on board at NMC. We feel your energy and leadership already, so we're totally grateful that you're with us.
Yeah.
So let's start off and find out a little bit about you so our community can learn more about you, and maybe tell us a little bit about your background and some of the things you've done in your work.
Sure. I come from Long Island, New York. I've spent 20 years practicing family medicine down there, and I've done a variety of things. I began my career shortly after residency working for Suffolk County Department of Health, and I did a lot of work there other than just seeing patients. I was medical director for 3 health centers, medical director for the Migrant Health Program, HIV specialist, chairperson for the Quality Improvement Program. I left my time there after 13 years seeking an academic position at Stony Brook University, and my role there was assistant residency director working with family medicine residents, medical students, dental students, program director for patient-centered medical home. So I really have done a lot, and I feel quite grateful for all these opportunities that have come my way in the past 20 years. So 20 years, and I've done a variety of things.
You have, my gosh. And part of that was serving the underserved population. And what was that experience like?
Yeah, so serving the underserved population allowed me to gain skills that really looked at what the social determinants of health were.
Yeah.
And working for the health department, they really welcomed everyone. And they looked to the community, they looked for advocates in the community to find resources for the challenges that our community faced. 2 examples that I can give was serving the migrant workers on Eastern Long Island. They could only come in the evening, so we kept our health centers opened in the evening to provide this special type of care for our migrant workers. HIV affects many of our Long Islanders. Eastern Long Island, because of the geography, is challenging for them to go to the big academic center to receive their HIV care. So what the health department in Suffolk County did was they began a pilot program to train primary care providers in HIV medicine, and I was part of that pilot program. So we were able to provide HIV care to this population in their own community.
Wow, that's fantastic. So the social determinants of health are so important, whether it's, housing or maybe transportation if they couldn't get to the medical center, food. I mean, there's so many things that really determines total health. So that's pretty powerful. Now, you also mentioned the patient medical home. And so talk about your work there, and is that something you're doing here as well?
Sure. So the patient-centered medical home is a medical model of healthcare. And what this emphasizes is care coordination. It emphasizes bringing evidence-based practice into the primary care setting, and it transforms the practice to make it what the patient wants. So this provides the right care, the right amount at the right time for the patient, ensuring safe care and better care in terms of health for the patient. And my prior role in the patient-centered medical home was as program director, and this allowed me to bring my prior practice to the highest level of recognition that the National Committee for Quality Assurance, NCQA, provides to practices.
Wow.
So we are, primary care here at Northwestern Medical Center is a level 3 accredited patient-centered medical home. And you go through cycles of reaccreditation. So we are involved with continuing to bring our practice to the most elite level of patient-centered medical home.
Wow. So what brought you to Northwestern Medical Center? It sounds like you were doing so many great things there. So what brings you here?
Right. So, as a family physician, I always envisioned that at some point in my career, I would practice medicine in a smaller community. And Northern Vermont is an area where myself and my family have visited many times. And so one day this opportunity for medical director in Northern Vermont came along, and it really piqued my interest. And then in beginning the conversations with the senior leadership here at Northwestern Medical Center, I became really excited with everything that NMC was doing, in particular being at the forefront of healthcare reform and being part of these wonderful initiatives like Rise Vermont, and trying to put the steps in place to really promote health and prevent disease. And I felt like I could be part of this organization where perhaps I can make a difference on a larger scale.
Wow. That's terrific. And when we were talking with you, we were equally as excited that you presented to us with all of your experience. So what is your role as the medical director?
Right, so this is a new position for primary care, and so I envision my role in continuing to transform the current practices of Northwestern Primary Care and Georgia Health Center to what I would consider an elite model of patient-centered medical home. So it's a continued transformation process. I also see my role in bringing wonderful performance improvement and quality assurance projects to the practice, and also with my academic and interest in education, I hope to continue to provide not just education to our patients and community, but also be a role model for our providers and help enhance our educational opportunities for our providers and learners such as medical students and residents. I hope to be able to bring that here to NMC.
That would be wonderful to have more access to students and being really a learning organization. So how do you work with like social workers and dietitians, and how do you work with other aspects of the health continuum, I should say?
Right, so being trained in family medicine, we're trained to work in a multidisciplinary fashion. And so we look at providing health for the patient not in a silo, but in a forum where, in order for the patient to reach their health care goals, we need to be able to work together as a team. So depending on the patient that I have in front of me, I look to see, does the patient need other services? Do I need to get others involved? And it works vice versa. The social worker may be working with the patient that may need some specific medical care, some specific healthcare goals met, and they will come to me. So it's a collaborative effort, and it's always ongoing, and it's really seamless here at NMC.
Yeah, I think that it really is the key to it, is that how we're putting wrapping around the patient and making sure all of those services and all of the resources are available, so nobody gets lost and there is a full continuum of care. And you're right in the center of that, really facilitating that. That's wonderful. So are you also seeing patients as well as being the medical director?
Yes, I'm seeing patients. I see patients both in St. Albans at Northwestern Primary Care and at Georgia Health Center. I see patients 4 days a week of all ages, including newborns.
I was going to ask you, so being a family physician, what is your preference and what is your range? And
yes, I've always practiced the full scope of family medicine, with the exception of OB, even though I have provided prenatal care in the past, but I do not do deliveries, but I do provide hands-on family medicine care to the whole family, newborns to my 100-plus-year-old patients.
100 and plus.
Yes.
Those long, healthy lives.
Yes.
I guess that's what Rise Vermont is trying to do, right?
Exactly.
Trying to create a healthy environment, and with all this, with primary care, helping them live healthy, long lives. So where are you actually located? Because there's been some changes on the hospital campus. So where can folks find you?
Right, so it's really exciting because we're in St. Albans. We're in the new medical office building right on the campus of the hospital. So it's a beautiful new facility, and we're there with some other disciplines. So it's really exciting. And Georgia Health Center is in about 5 minutes, 10 minutes south of St. Albans.
Yeah. That's great. That's nice that you're finding yourself in both places, and I'm sure the providers that are there, because this is a new position, they must really be finding it that you're a great resource. And so, are there some structures that you're thinking about putting into place, or what do you think are your first priorities?
Right, so one of our biggest priority right now is the patient-centered medical home, and really looking to see, because our accreditation process is beginning for next year, so 2018, that's
wow.
one of our biggest goals, is because there are some new indicators that we have to work on, so they have to get put into place. So one of my biggest roles is going to be to really, especially for our new providers, to really bring them on board on what a patient-centered medical home is, and really retrain the staff in terms of what our purpose is as a patient-centered medical home. So that's one of my biggest goals for 2018.
That's terrific. And when we think about kind of those quality outcomes and things that patient experience, and we're hoping that as folks are coming into that new building, that it's more accessible, easy to access. You got volunteers right there, so that you're easy to find, and that in and out, and that communication, and that follow up. Hopefully we're realizing what the building was meant to do, which was really to be more accessible for the patients, so that we really improve that experience. That's what we're hoping for. And with you there, kind of leading behind, and the providers, and working together as a team, hopefully that's going to be a powerful combination, and the community will feel that. So tell us a little bit about Dr. Fingergut, who's not in the practice. And so maybe tell us a little bit about your interests and the things that you do with your family.
Sure, so I'll begin that I'm first-generation American. I was born to parents from Argentina and Colombia, with Spanish being my first language, so I speak it fluently.
Interesting, that's wonderful.
So my heritage is really important to me. In terms of things that I enjoy doing, spending tons of time with my husband and sons, that's really important, doing activities that we all enjoy. We enjoy the outdoors, kayaking, downhill skiing. I enjoy doing reading, traveling. I enjoy trying out new cuisines, cooking, and learning about different cultures.
Wonderful, wonderful. And so you probably have tried some restaurants in Burlington. I don't know if you've wandered to Montreal yet, but we have access to a variety of things.
Yes, I have tried restaurants in both places, many.
We'll have to compare notes regarding this. So our time is fast closing upon us, and so what do you find most rewarding about your work?
Yeah, so medicine, especially in this day, can be a little challenging. But when I really look back to see what I find most rewarding in being a family doctor is patients who set healthcare goals for them, and then they work together with their healthcare provider in terms of reaching their goals. So for those that set goals in terms of weight loss or smoking cessation, and we help see them through in achieving those goals, I find that so rewarding and so happy for them. Being a family doctor, I feel that it's a unique position in the healthcare field, because we get to see the whole family, the family dynamics. And these are patients that I may have from infancy, and see families through different generations, and that is truly a treasured role. I don't think there's any other specialty that really takes you to that place. So I really feel humbled that here I am 20 years and have been able to be a part of many people's lives and families' lives.
That really is amazing, to be able to touch all aspects of their lives and their families' lives. It's primary care is really the center of the healthcare delivery system, and you're right there. And as the medical director, you're able to not only influence the patient care that you give, but really to impact the patient care, across our organization and even across our community. So it's wonderful to have you here, and you're setting a whole new place for us and our role with primary care. So thank you for that.
Thank
Appreciate
you for having
that.
me.
And I'm sure you've got patients probably waiting for you.
I do. And I won't be late.
So again, thank you very much, and thank you for taking the time to be a part of our show.
You're welcome. Thank you.
And introducing yourself.
Thank you for having me again.
Yeah, it's certainly our pleasure. So I'm Jill Berry Bowen, CEO of Northwestern Medical Center. Thank you for joining us for this show, to learning about Dr. Fingergut and our commitment, along with the other providers across this community, to provide the best primary care access for this community, because it is the centerpiece for really the healthcare delivery system and for your overall well-being. So make sure you have a primary care provider. Thank you.